Hi everyone, I'm here at LUXX Medical Aesthetics with Ruth Johnson from DermaStamp, Canada. And she is the expert in Oxygeneo and also in microneedling eDermaStamp. So I thought we'd have a little chat and share with you our little chat about microneedling. So with microneedling, the first thing that I love to tell people is that it's Health Canada certified. Absolutely. I think there's a lot of microneedling devices out on the market that are not Health Canada certified. So for me, that is very, very important. And that's why I went to the best to buy our microneedling machine. So with microneedling, you can get microneedling for various things. So if you have concerns with aging, you can have microneedling for lines and wrinkles. You can also have microneedling for scars, for stretch marks. So first, let's just sort of put it into three groups. So this is the first group of what you can have microneedling for. And in the second group, we'll talk about pigment correction. And in the third group, maybe we can talk a little bit about hair restoration. Sound good?
You sound great.
Okay, so let's talk about collagen induction therapy. If you can expand a little bit on what that is and how it works for lines and wrinkles, scars, and stretch marks.
Okay, so collagen induction therapy is a term, it's a medical treatment in where we are creating non-traumatic wounds in the body.
Right.
To promote our own body's natural healing process.
Right.
Now, I say non-traumatic because, pardon me, when you are creating traumatized wounds, you're going to facilitate collagens type 2 and 3, which is your scar tissue, which is parallel formation.
Right.
And there are some microneedling devices that actually will promote that type of collagen as opposed to collagen type 1.
Right.
So when we are creating non-traumatic wounds, we are only going deep enough to achieve a pinpoint bleed.
Right. So how deep are we going with the microneedling?
Well, that depends on the skin.
Right.
The maximum depth that the eDermaStamp needles will go to is 1.5 millimeters.
Okay.
Reason being for that is that the epidermis and dermis together are only 2.5 millimeters in its entire depth.
Right.
So there's no reason to go that deep. If we're going deeper than that, we're going into cutaneous tissue, and we're really creating unnecessary inflammation that we don't need.
Exactly.
So I can't say that you're always going to go a certain depth because it depends on the skin that you have in front of you.
Yeah, because I do find that when I'm working on, everybody is so individual, and you know, we start with a say 0.3 millimeters deep on the forehead, but some skin is a lot thicker, so I'm finding I do have to put the depth deeper. A little bit more.
Yeah,
to get that, you know, that redness that we want to create, not a pinpoint bleed, but more just on the verge of that.
Right. And that's the thing, a lot of unfortunate things in the social media is that you will see people that are literally a bloody mess.
Yeah. That's
not necessary. That's for shock value.
Right.
If you see a scattered pinpoint bleeding on your area of treatment and they look like they have an even sunburn or windburn, then you have treated sufficiently.
Right.
So that's all you need to do to create that.
Yeah.
And our device is the fastest device on the market. 150 insertions per second.
Right.
Our needle cartridge has 6 needles properly spaced apart because you cannot change physics.
Right.
There needs to be a certain amount of space between your needles to ensure that you're going to actually have the penetration of those needles. Right. So in that, we are creating 900 healing sites per second. So in a true CIT treatment,